Many women who've been unfortunate and have experienced recurrent pregnancy loss or recurrent miscarriages or habitual abortion often believe that surrogacy is the right treatment for them. Their logic is very clear, and in fact a lot of doctors believe this too. The fact that they're getting pregnant means they don't have a fertility issue, which means the eggs are okay, the sperms are okay, the tubes are okay. The embryo is implanting in the uterus, but the uterus is not able to hold on to that embryo. It cannot sustain or support the pregnancy, which means if there's a problem with the uterus, it's just common sense. You find another woman, it's called a surrogate, who's had a pregnancy in the past, whose uterus is normal. And if you then put that intended parent's embryo in the surrogate's uterus, that embryo will continue growing and they'll be able to have a healthy baby because she will have a healthy pregnancy. Actually, this reasoning is completely flawed. And let me explain why. What people forget is that the uterus is passive. It's like the soil. It's the seed or the embryo which is active. It's the seed which actually does all the work. The uterus doesn't have to do anything at all. And this is in fact why for older women who, let's say 60 even, the world record is actually 72, have gone on to have a healthy baby using donor eggs, which means the uterus, even though she hadn't had a period for 20 years, was absolutely fine once you started treating her with hormones, and she could carry a baby all the way to 9 months. Now remember, if this woman can carry at the age of 72, she's not going to have a problem carrying at a younger age. And that's exactly the point. The uterus does not have a biological clock. The problem is that they are not able to carry the pregnancy because the embryo is genetically abnormal. It's very hard to make a diagnosis of a genetically abnormal embryo, but that research has been done multiple times, that the commonest cause of a first trimester miscarriage is a genetically abnormal embryo, and the commonest reason for a genetically abnormal embryo is genetically abnormal eggs, which usually happens in older women because their eggs have aged and have accumulated a lot of genetic defects, which we can't diagnose, we can't treat, we can't prevent, we can't predict. That's why it's so random. Now, interestingly, because the uterus is passive, therefore, what they really need to do is not worry about changing the uterus. What they need to do is change the embryo. Again, this sounds very counterintuitive, but it's the truth. And the reason for this is that it's the embryo which determines the fate of the pregnancy at the end of the day. In fact, a woman who's had recurrent miscarriages most of the time has a completely healthy uterus. After all, if a uterus hadn't been healthy, the embryo wouldn't have implanted in the first place. The fact that the embryo implanted means the uterus is working fine. The embryo can't continue to grow because it's genetically abnormal, which is why nature terminates that pregnancy at either 8 weeks or 10 weeks or what have you. And this is why these women do not need surrogacy. Because even if they did a surrogate with their own eggs and sperms, that surrogate would end up miscarrying again. Because the underlying problem, the genetically abnormal embryo, because of the genetically abnormal eggs, is not going away. What these women require to have a healthy baby is donor eggs, which doesn't sound intuitive, I get that, but that is the one treatment option which will maximize their chance of having a healthy baby. Because once they use a younger woman's eggs, those eggs are much more likely to be genetically normal as compared to using their own eggs, which have a much higher risk of being genetically abnormal because they're older.